So Dr. Tabor, I have to say, when you first walk in here, it does not feel clinical because you don't have a waiting room.
No.
Why don't you have a waiting room?
Well, I don't want my patients to wait. I have what's called a direct pay office in which you pay a monthly fee for me to be your doctor, and then I'm available for you 24/7, 7 days a week, through text, through email, however you want to get a hold of me. And when you have an appointment, it's your appointment. You're not stacked with 5 other people, and it's not like a cattle call of people going in. It's you and only you, and I will spend as much time as I need with you.
Okay, so you're saying that people don't wait. You
No,
said that.
not at all.
Okay.
It's a reception area to have people come in rather than actually wait and, be worried or whatever. No, you come on in and you meet with me.
What other ways would you say you are different than most physicians in Northern California?
I am a board-certified family practitioner. I went through medical school and residency and worked in the hospital for 3 years and wrote plenty of prescriptions. I do what's best for my patient based on what my patient tells me. If somebody tells me they don't want a prescription, they want to look at other things they can do, I am open to that and trained in it. I've got a lot of experience in alternative medicine.
So you're a general practitioner.
Yep.
But you specialize in a couple other things?
Well, I'm an osteopath. I do adjustments to help get the body back in balance, help things function better, sports injuries, all the way from fibromyalgia to vertigo, which is dizziness. I'm certified and have a Photona laser, which I'm the only one in Northern California that has this laser. It does 50 different procedures, all the way from a complete facelift to removing warts or stretch marks or veins. So it does
a lot.
It does a lot.
Yeah.
That's what I do.
And for a touch point for people, how would you say that you are like some physicians?
A particular patient comes to mind, somebody who's into alternative medicine, and she came in with a wound, and I said, you needed that stitched, and she says, well, I know, but I really didn't want to. I put her on antibiotics. We took care of it according to what we were supposed to do, and she's all better now. But she really wanted to try to handle it another way, and I had to finally tell her, no, this is what needs to be done to make sure you get better.
So you're a phisian first and foremost.
Yes, absolutely.
But you're obviously open to other ways of
Yes,
helping your patients.
absolutely.
Whatever works best for them.
Yeah, high blood pressure is one. There are many ways to handle the high blood pressure, and a pill is one of them. But another way is let's talk about lifestyle changes to not have to go on medication.
And I see a kitchen behind us, which
Yes.
is something you typically do not see in a doctor's office setting. Is that one way that you may address something like high blood pressure?
Absolutely. I do cooking classes once a month, and I also can talk with my patients about how to make lifestyle changes so they don't have to go on medication.
And I also noticed a gym too. There's a gym here.
I used to be a personal trainer. We have classes that are done here on a regular basis, and at the same time, if somebody wants just a simple exercise, we can go in there and I can show them a few things, and they can do it at home.
You focus on general practice, your typical overall health issues, but also you're able to address, facial stuff for women, you know, like aging things.
How about hair restoration in men? That's what the laser does that too. How about snoring in men? People that have sleep apnea, a 3-part procedure can eliminate the snoring so you don't need to use the treatments that are prescribed nowadays.
And it sounds like that you're really building on the relationship with your patient.
I know my patient. They call me and I've already seen them about something. I can easily say, let me send in a prescription for you. You don't have to come into my office all the time for something that you have a history of or something that I've already seen. The technology that's available, you can see your doctor through FaceTime, but do you want to see a doctor you know? Or do you want to see a doctor that you've never met before and they don't know you? And that's exactly what I'm trying to do, is get to know my patients so I know what they want, and I can say to them, well, there's this option and there's this other option, and I know that you want options.
And why should people trust this form of practice?
Most of my patients are referrals from other patients. When you experience what I do here, you'll see that I'm different. I am not the doctor for everyone, and I wish I could say I was. But I'm different than what's out there, and if I can help you, I will. If I can't, I know somebody who can, and that's kind of what I'm trying to do, is put together a network of health practitioners that can help you with whatever you need help with.